Hi everybody, I'm Madison, and today I'm going to be talking about common medical issues within horses. I want you to imagine a world where you own horses. Now, what if one of your horses got sick? You would want to know what symptoms to look for and treatments to use. As someone who has grown up with horses, I believe this is a very important topic to be discussed. Horses are known for common injury and health issues. It can be as simple as their gut. I plan to talk about 4 common but pretty major medical issues, the symptoms, and treatments for each. Those would include colic, laminitis, abscess, and gastric ulcers. All of these issues I have seen or dealt with. The first common medical issue I will be talking about is a colic. A colic is an indication of pain in your horse's abdomen coming from the horse's gastrointestinal tract. Compared to all the other topics, colics are pretty much unavoidable. The most common signs of a colic that I would look for are lying down or rolling, biting or kicking at their belly, little or no passing of manure, poor eating and drinking behavior, and a fever. The first step to treating a colic would be to get your horse up and moving, call your veterinarian, remove any food from the horse's stall, which can cause more pain, and lastly, check your horse's vitals. The second common medical issue would be laminitis, or often known as founder. It is caused by an alteration in the blood supply of the foot, which results in damage to the sensitive lamini, where the hoof is attached to the foot. Factors that can cause laminitis would include overfeeding, overweight and lacking exercise, excess weight bearing on one or more legs, running on hard surfaces. Some signs to look for would be if your horse is standing on all 4 feet close together, head low and back arched, profuse sweating, and facial expressions of pain and anxiety. In a mild case, therapy can be used. In a more severe case, a veterinarian may be able to treat the pain, but not an immediate cure. Laminitis can also affect all 4 feet at a time. The third common medical issue I will be talking about is a hoof abscess. A hoof abscess is an infection that gets trapped in the horse's hoof and then forms a pocket of exudate or pus. An abscess can start from many different things, such as poor hoof care, a puncture wound, changes in weather, and an inconsistently clean stall. Some symptoms would be lameness, swelling of limb, heat from the hoof wall or limb, increase in digital pulse by the fetlock, discharge coming from the bottom of the hoof, and foul smell. Some treatments would be draining the abscess, which has to be done by a vet, soak the hoof in warm water and Epsom salt, and use a poultice pad and wrap the foot, which may need to be done daily. My last and final common medical issue I will be talking about is gastric ulcers. Gastric ulcers are sores that form on the stomach lining of the horse's stomach. Clinical signs to look for if your horse has been affected would be poor appetite, dullness, attitude change, decreased performance, reluctance to train, poor body condition, poor hair coat, weight loss, low-grade colic, and girthiness. Gastric ulcers can be diagnosed through a gastric endoscopy and can be treated with a pharmaceutical treatment called omeprazole. Thank you.